What do we know about the COVID-19 Omicron variant and how this can affect your mental health? By the end of this video, you'll know more about how this impacts your mental health and what to do to remain stable. Welcome everyone, this is Dr. Air, quadruple board certified psychiatrist, addiction specialist and lifestyle medicine physician. The World Health Organization WHO recently announced that the Omicron variant of the COVID-19 virus, B.1.1.529, has been elevated to a variant of concern. What makes this variant quite concerning is the fact that it seems to be fast spreading, contagious, and might be able to evade the COVID vaccine. As of this time, however, these are more speculations as scientists are still learning about this virus. We know the COVID-19 pandemic has taken a toll on us all, not just physically, but also mentally. There is a rather scary relationship between mental illness and the coronavirus. This virus has been known to aggravate and precipitate mental disorders. Also, according to the Centers for Disease Control and Prevention (CDC), mental health disorders can put people at higher risk for severe COVID-19 illness. In fact, it is for this reason that booster shots of the vaccines were recommended early for people struggling with mental disorders. A few studies published this year found a link between mood disorders and higher risk for severe COVID-19 outcomes. Now, this is very concerning, especially when you consider the statistics. According to the National Institute of Mental Health, nearly 1 in 5 US adults live with a mental illness, which can vary in severity. There is no doubt that mental health worsened during the pandemic. In fact, a global study showed that 53 million new depression cases were diagnosed in 2020. Let that sink in. 53 million new cases of depression. There was an interesting poll carried out by the American Psychiatric Association, APA. It showed that about 48% of Americans are anxious about the possibility of getting coronavirus, and about 40% are anxious about becoming seriously ill or dying from it. About 36% of Americans say the coronavirus is having a serious impact on their mental health, and close to 60% feel the virus is having a serious impact on their day-to-day lives. It is obvious that the stress and anxiety caused by the pandemic is having a huge impact on people's physical and mental health. There has also been an increase in sleep difficulty, fights with partners and loved ones, as well as an increase in alcohol and drug use. Our hope is that the Omicron variant is not severe enough to cause another lockdown like we previously experienced. I'm sure we all recall how much of a struggle it was to go through that. We are hoping that Omicron is not a severe variant and that it is easily contained. At this time, we are still in the pandemic, and this remains very uncertain times. As you know, anxiety always increases in the face of uncertainty. This makes it really important that we do what we can to manage our anxiety, stress, and also maintain self-care. To maintain your mental health and cope with stress, it is important to reduce your risk to contact the virus. So we're talking proper hand washing, social distancing, wearing a face mask. Maintaining a routine involving a balance of time outside, relaxation, and connecting with friends and family is important. Such connections can be done safely in person or through technology when necessary. Yes, we know it is important to pay attention to news on the virus, but it is equally necessary to take breaks from time to time, including from social media, so you don't get overwhelmed. Social isolation is a big culprit for mental health disorders during the pandemic, so it is very important to remain connected with family and friends. Safe in-person meets, healthy use of social media, and regular phone calls go a long way. In speaking with children about the coronavirus, the most important thing for them to understand is that their concerns are being heard and that the adults in their lives are doing everything they can to keep them safe and healthy. Spend time, if possible, in normal activities with them and listen to their concerns. If you're struggling with your mental health, it is important to see an outpatient mental health professional for evaluation, medication management, and/or counseling. In severe cases, you may require an intensive outpatient program IOP or a partial hospitalization program PHP. More severe cases or situations in which there is a risk to self or others may require inpatient hospitalization. If you reside in the US and you're currently experiencing a crisis, you can call the Disaster Distress Helpline 1-800-985-5990 or the National Suicide Prevention Lifeline 1-800-273-8255. You can also text TALK to the crisis text line at 741-741. Subscribe to this channel for more tips on mental health, addiction, and wellness.